Hey, I am Dr. Michael Tebbe with Chiropractic. So today I want to share with you, this really applies to pregnant women, but it also applies to general public as well. So we've talked about diaphragm breathing, and I've showed it to you laying on your back. But we also want to, so women who are pretty late stage pregnancy don't want to be laying on their back because it's just not very comfortable. It's heavy. So we want to find a way to do diaphragm breathing, and which will be on hands and knees. So quick tips: if your hands don't feel like it feels uncomfortable for your wrist to be like that, find something. A towel would probably work better than books, but you get the point. Like, find something so you can have less of an angle on the wrist. So that's one tip. So next, positioning. So let your belly drop as much as you can, kind of round this way, and then kind of find right in between. So what we want to feel is that rib cage and pelvis are pretty connected. So I'm just going to lift this up. So here I'm pretty connected. That's not connected. This isn't connected here. So now my rib cage is facing down into my pelvis. So they're going like this, not here, so not like this, not this, here. All right, so we got that. Now next, third thing, shoulders. We're going to slide the shoulder blades around the rib cage. So sometimes the way you can feel that is take this crease of your elbow and turn it forward, and then push up from there. Okay, now we got that set. And then maybe have somebody touch you here. Could be a partner, whoever. So you're trying to breathe into the whole bottom of the rib cage. So even my back should be pushing up into the air, my ribs should be pushing out to the side. And again, you don't want to be doing this, super aggressive inhale. Just real easy. So for pregnant women who are feeling like belly tension, lower belly tension, if we can get your rib cage to start to move and release some of that tension, you're letting that whole fascial connective tissue, you're giving it space so it doesn't leave all the pressure right at the bottom of the belly. All right, so we are here. So you can do this for a minute, 2 minutes. Yeah, and that's a great thing to do. So why do we want to do this even if we're not pregnant? Because we want to train our body to be able to make this a reflex of this diaphragm breathing when we're in all different positions, not just laying on our back, maximally relaxed. So here, this position, I'm not as relaxed as I am as on my back. And then once I get that, and once I'm comfortable with that, then we can increase the challenge and then pull the knees off the ground. So now we are working the core while keeping our diaphragm breathing engaged, and that makes you super strong. So diaphragm breathing. Breathing is the first thing we do, last thing we do in this life. And when properly engaging the diaphragm, you'll find that it changes so much stuff. Test it for yourself. Before doing the breathing, check your neck range of motion, check your shoulders, check your hips, check it all, or whatever. Just pick a few things that you know tend to be tight, and then do this and see how it changes. So 1 to 2 minutes, diaphragm breathing, especially helpful for a third trimester pregnancy. When your bump is starting to get heavy, it will give you space. And by getting the diaphragm breathing engaged, you can help your pelvic floor start to soften. And that's also a good thing, especially if you're laughing, sneezing, and getting some leaking happening, incontinence. All right, enjoy.